Gainwell is a company that's not a household name in Arkansas, but it will be soon, especially in Conway and the central Arkansas area. The healthcare IT giant has a big presence there in Conway. I caught up with Dr. Gary Call, Senior Vice President and Chief Medical Officer for Gainwell, to talk about the future of healthcare and healthcare IT. Dr. Call, first of all, thank you so much for joining us at the end of the week here. Gainwell is a new company, but it's got a 50-year history in healthcare technology. Share a little bit more with me about what Gainwell does and the premise that you guys are built on.
Yeah, sure, Roby. Thanks. Appreciate the opportunity. So Gainwell is a new name, but the company really has been around in different forms for 50 years. And we are a health IT company. We really work a lot in technology that delivers health and human services and public health programs. So we work with a lot of states, and that's something that, like I said, we've done for a long time. So our solutions really are about supporting for the most part, Medicaid patients, so that program for the most vulnerable people in the community. And that's really our mission, that's really our focus. So we have over 10,000 employees. We are a nationwide company. We have 600 employees here in Arkansas, including over 400 in the Conway area. So we have a really great partnership with the state and the local community. Like I said, the mission is really about serving the most vulnerable people in the healthcare system. So that's a mission that our employees can get behind and feel really great about. We really support the majority of states in the United States, though. So in addition to a great partnership with Arkansas, we also partner with a lot of other states around the country.
Let's talk a little bit about the IT that you collect, the information that you collect, and how you can use that. I'm going to put together a very layman's terms example. You tell me if I'm right on this and maybe take it a little step further. Let's just say that through the course of all the business that you do with the different states and with Arkansas, you see a particular medicine maybe results in 3 follow-up visits to the doctor. A different medicine maybe results in 5 follow-up trips to the doctor. Therefore, the 3-trip medicine may be better than the 5-trip medicine. Is that a somewhat of a simpleton's way to explain how you use the technology to create some best practices?
Yeah, that's one way to look at it. I mean, one of the base things that we do is we provide the systems that enable states to run their Medicaid programs. So enrolling their members, enrolling the providers in the program, paying the claims, providing access. So in the course of that, though, we have the opportunity on behalf of the state to collect a lot of data. And that allows us to do analytics. So kind of to the point that you just made, analytics are really about taking all of that information. You know, we just have so much information on these healthcare systems. It allows us to then provide analytics to the state and the leaders in the Medicaid program. It also allows us to provide insights to providers. And it helps us draw some of those very conclusions that you talked about, which is really about how can we help contain the costs of healthcare? How can we get better outcomes? How can we make sure people have good access to care? And then how do we sort of enable population health and care management programs that really do outreach and education to individuals and groups of people based on being able to draw some of those conclusions that you talked about?
So the COVID-19 pandemic clearly changed the way that healthcare is delivered and consumed in many different ways. We've seen everything from worker safety to patient protocols, public health, all just completely disrupted as a result of the pandemic, and certainly an acceleration of telemedicine. As bad as this pandemic has been, do you see that there is good that is coming out of this in terms of transforming the healthcare system?
Yeah, I think we've learned a lot of lessons in the healthcare system from the pandemic. I mean, first of all, I think we learned that virtual health is a thing. You can deliver healthcare virtually. And I think that opens up a lot of avenues towards access to care that maybe people didn't have before. I think we've learned a lot about the importance of what we call whole person care. That's something that at Gainwell, we're working to build solutions that allow people to sort of have a seamless consumer experience. The Medicaid patients have really limited access to care in some places. And so trying to improve that by looking at the whole person. So, we look at what's called social determinants of health. So things like people don't have access, they don't have transportation, there are no healthcare providers in their area, or maybe they don't have access to good nutritious food, or maybe there are mental health issues where there's no access to care there. Maybe they have bad housing or no good housing available that's affordable. So all of those types of components are really part of the whole person. And I think what we've learned is healthcare is about the whole person, not just taking care of their high blood pressure or whatever. So I think that's the lesson that the healthcare system needs to take forward is how do we develop solutions that allow people to solve some of those problems and overcome some of those barriers to good healthcare. So again, at Gainwell, we're sort of committed to this whole person model and helping people navigate not just the healthcare system, but many of the social issues that may be causing them to not have optimal health.
So let's talk a little bit about Conway and Central Arkansas specifically. If someone has not stepped foot on the Gainwell campus there in Conway, what types of jobs, what types of workers are there? Where do you see potential future growth?
Yeah, so I mean, I think the healthcare system has a lot of problems that need solving. I think everybody can figure that out. So Gainwell's committed to that, but as part of that, we need to grow. And we are committed to the community of Conway and to Central Arkansas. We partner with some of the local universities. In fact, I'm here today to participate in the opening of the University of Central Arkansas's new Integrated Health Sciences Center. So I think what we're looking for at Gainwell is, again, as a technology company that's focused on healthcare, first of all, we need healthcare workers, right? People who have expertise in healthcare. So we need clinicians, nurses, pharmacists, physicians, a lot of different people with healthcare experience, but we're also a healthcare technology company, so we need tech people. So we need software developers, we need cloud engineers, we need people with experience in artificial intelligence and machine learning and robotic process automation. So there's just a lot of opportunities. We also have a really big customer service center. So we need people who excel in making a better customer experience. We have business operations that are happening. So we need people who are experts in running a business and an operation. So lots of opportunities where we need highly skilled people. That's where the partnerships with the local universities come in. So we've got at UCA, we've got Hendrix College, we've got the University of Arkansas as a health sciences school here. So a lot of opportunities to get these highly skilled workers in the area. And that's why this partnership is so important to Gainwell.
My son is a freshman at Hendrix College in Conway. If you could just hold off about 3 more years, I'd be happy for you to offer him a nice salary with benefits, Dr. Call.
I am sure we'll be ready and willing and waiting for him when he's ready. I mean, really, we are growing. We have about 130 open positions right now and plans to grow that even more. We've got several hubs. We've got our pharmacy hub that we're building here, providing pharmacy services across the country. Like I said, a big customer service center, providing customer service support to over 14 different states around the country, a lot of technology stuff. So really just focused on growth in this area because it's been such a great partnership for us.
All right, Dr. Gary Call, thank you for your time. I appreciate you very much.
Yeah, thanks for the opportunity. Thank you.